Very good evening to everybody. We are meeting again in the session of Materia Medica. Yesterday, we have finished one more remedy from third year's syllabus and a practical approach of it. Today, we're going to learn another remedy, a polycrest from the homeopathic Materia Medica. Little bit overlooked many times because we used to come to the conclusion of many times towards the entim tart instead of this remedy. We miss this remedy many times, but this is the big polycrest from homeopathic Materia Medica having in-depth action, nearly about 40 days action, and that is the ammonium carbonicum. What happens, we generally never looks towards this remedy from all its aspects. My suggestion to you, yes, I will going to share the Allen's notes, but along with Allen's notes, I will ask you to go with the Borix Materia Medica. I will ask you to go through the Kent's Materia Medica, and if anyone is having the Materia Medica Viva by George Vitulkas, do read that. Then you will get the depth of this remedy, a very important remedy in day-to-day practice and having lot of importance. I will share few cases with you, and then we'll learn it from the Alensky notes. The first case, it was a very typical case of 6-year child who was brought to me with a complaint of adenoids and obstruction of nose at the night. Along with, he had a very severe allergy to the dust. He used to get the cough very easily gets affected with the cough, and which is aggravated always with the dust, associated with dyspneic attacks. What parents told that we have to be very watchful to him, because at night he cannot breathe through the nose. He used to keep his mouth open, and he suddenly gets from the sleep, and as if his breathing is stopped, that feeling is there. He gets so much of dyspneic. Generally, it happens between 3 to 5 a.m., generally more commonly at 3 o'clock. There is always a cough associated with a severe breathlessness at that time. This fellow never likes to take a bath. There is absolute aversion. He never likes to touch the water. That is the problem with this child. He used to bath every alternate or every 2 days after. He never likes to do a bathing. So what happens? Generally, we consider that if there is a dust allergy, then there is a breathlessness at night, 3 o'clock, respiratory complaints, more goes towards in favor of Kali Carbonicum, 3 o'clock. And that's why we miss ammonium carb. But in this case specifically, the adenoids were there, the scrofulous diathesis was there, cough was aggravating because of dust, and basically the nose gets totally obstructed at night. That is specifically at 3 o'clock. The remedy mentioned are very few. One of them is ammonium carb, another is lycopodium. But this fellow was not at all lycopodium. One more feature which was there, aversion to bath. Generally, we goes in favor of the sulfur whenever aversion to bath is there. But if you open the repertory, you will get ammonium carbonicum is the remedy. But why this aversion to bath is there? In ammonium carbonicum, these children, these peoples gets aggravated because of touch of water. They avoid. There is fear of touching the water. Their complaints gets aggravated. Their problems gets aggravated during damp, wet weather, getting wet in the rains. And that's why there is always an aversion to bath, which happens to be there. That's why they remain uncleanliness, looks like uncleanliness. We miss the remedy towards the sulfur because of this. But the reason is different over here. So they already, the child was posted for adenoidectomy, but someone told my name, the child was brought to me, and I have started the treatment. I have started ammonium carbonicum directly 30 few doses and followed by a biocombination number 5. When I follow what's going on, every time he was recovering, it took a long time. This remedy is not a remedy which will act instantaneously. The carbon group of remedies are little bit slow to act. So he started getting a recovery after first 15 days. This first important point was he was sleeping in a good way. He was getting good sleep. He never get used to get in the night, wake up in the night. So that was one important positive sign was there. Then I have continued ammonium carbonicum 30, 200 up to 1 m. And later on, these complaints, whole complaints of the child, the dust allergy has vanished, the breathlessness has completely stopped, then cough has stopped, the night breathing, which used to keep the mouth open, that has gradually reduced. So his breathlessness and obstruction of nose has stopped completely. They have told one more thing that with which I have confirmed the remedy more strongly, that he used to get a bleeding from the nose and specifically from the left nostril, specifically during the summer weather, and it used to happen again and again. That is one more feature. Hemorrhagic diathesis is in ammonium carb. Then I asked what is the thing with which he feels better, and he said that they told that whenever he used to sleep, we used to apply the Vicks over there, and he requires that before sleep because without that he never used to get the sleep. That was another important thing, that these people always have a smelling bottle in their. That is the symptom in ammonium carb. There are two, three things which are there. These are the people, these are the ladies who are having this habit of applying Vicks, applying the balms, the tiger balm, the amrutanjan, then the Vicks inhalers, etc. Or some ladies carries the ammonia bottle with them. The reason behind that ammonia bottle is that these are the ladies who used to faint very easily. They are the victims of CCF, congestive cardiac failure. Their heart is too weak, and they generally, if they feel that they are getting the vertigo and they are falling, they takes just a smell of it and the heart again works. That was the one of the reason, that smelling bottle, they always carry the smelling bottle in their purse. That is the symptom which is mentioned over there, has this meaning. So that was a wonderful case treated with the help of ammonium carb. And second case, I recollect, it is a obese young student from our college only, and she had a very severe dysmenorrhea. She was literally fed up of it. Every time she used to get dysmenorrhea, there is a severe gripping pain in abdomen, and she used to vomit a lot. She used to get to toilet up and on, and she becomes so weak those days. It remains first 2 days, but it always starts with the cholera-like symptoms like a vomiting and diarrhea, and she immediately knows that her menses are coming, and then pain in abdomen used to start. And she was literally suffered a lot, and she has consumed lot of. She used to consume that Dismen tablet, but whenever she consumed Dismen tablet, immediately it gets vomited out because there was a gripping colic, and that vomiting was very strong. She said, we I have to sleep for 2 3 days, and second important thing, many time I used to take the injections. This was so severe in her case. Or I asked, what about the bleeding? She says it is always profuse and it is too much strong. Many times when it touches the thighs, it makes the thighs sore. Her thighs get sore after the attack. Her thighs become so weak, prostrated after attack of this dysmenorrhea. Second important modality, what she has said, whenever this happens, only thing with which I feel better is lying on abdomen. So it stuck to my mind. Pain in stomach better by lying on abdomen, acetic acid. But it is not stomach, it is abdominal pain, better by lying on abdomen. Ammonium carb is also remedy. Second important thing, the constitution was very typical. She was stout, quite obese, and generally she was slow in reaction. One more important feature, what she has mentioned along with this dysmenorrhea, she starts getting the yawning. Dizziness in the daytime is another characteristic of this remedy. Daytime they get dizzy, and whenever dysmenorrhea happens, they at that time they get very much severe yawning. So I considered to give her ammonium carb. I have started her with ammonium carb 200, and when I have given ammonium carb 200, the next menses whenever happened, they came on in time. And second important thing, at that time it was quite possible for her to without remain without medicine. She has not consumed, she take the rest, she got one or two vomiting and diarrhea, but it was not so severe at that time. Then I have continued, I have increased with the potency after ammonium carb 200. Later on, I have given her ammonium carb 1M, and she recovered very nicely with that. But the exhaustion which she used to get earlier, that also settled. Otherwise, she used to suffer a lot, very severe weakness, exhaustion, prostration used to happen after that. So these were the two important cases where I have utilized ammonium carb successfully, and there are many more. But we're going to learn the ammonium carb from the Allen's keynotes. Open the Allen's keynotes. Ammonium carbonicum, smelling salts. It is 2NH4O and 3CO2. Hemorrhagic diathesis. First word is very important. It is a bleeding remedy, hemorrhagic disease. But what type of blood? Blood is fluid and degeneration of RBC. So hemolytic anemia, which is the very characteristic of the ammonium carbonism. It is hemolysis. Hemolysis happens to be there. Ulcerations tends to gangrene. Underline this. Whenever there is any wound, ulceration happens to be there, it leads to directly towards the gangrene. Constitution is mentioned in second paragraph. They are stout, they are fleshy women with various troubles, in consequence leading a sedentary life. That is more important. Carbon group likes a sedentary life. They never do the exercises. They are slow in reaction. That is more important. Very slow in reaction. Boric says slow in reactions. That is the sedentary life workers, and carbon always produces slow reaction. Delicate woman who must have the smelling bottle continually at hand, readily catch the cold in winter. And this is what I have told, the smelling bottle. Two per either ammonia carries the ammonia for the purpose of weak heart, fainting attacks, and second important, many times obstruction of nose with the like a Vicks, like Amrutanjan, like Vicks inhalers, etc. The smelling bottles they carry with them. Children dislike washing. The anti-crude, the sulfur, these are two remedies mentioned over there. We know sulfur never likes bathing. Here, there is great aversion to water, and water, in touch of water, aggravates the complaint. That's why there is a children dislike washing. Loses breath when falling asleep, must awaken to get the breath. Ag aggression by lying down is another characteristic of this remedy. Specifically, when it is related with the dyspnea, whenever it is related with the nose or nasal obstruction, This gets aggravated whenever the patient lies down. Grindelia, it is very specifically the dry cough which gets aggravated by lying down. Asthma aggravated by lying down is the Grindelia. Lachesis, it is general modality in lachesis. Ill humor during wet, stormy weather. So patient becomes disturbed during wet weather because their complaints gets aggravated. Wet weather, stormy weather always aggravates the complaints. The touch of water, getting wet in rains aggravate the complaints, and that's why during that time they are not in a condition to talk in a proper way. Headache, the sensation of fullness as if forehead would burst. So there is very severe bulging over there in the forehead, belladonna, glonine. But here it is deeper. This remedy has a deep depth of action. It is 40 days action. Belladonna and glonine, they are very acute. Congestive headache in belladonna, it is of acute origin. Glonine is very acute in the sun. It is very, very immediate. Here it is not so. Nosebleed when washing the face. That is another characteristic. Whenever they wash the face, immediately bleeding start. It is from the tip of the nose that has mentioned over there. Like arnica, makeup and hands in the morning. So whenever washing the face and hands in the morning, there is nosebleed. Nosebleed from left nostril, very specifically. And lastly, after eating. After eating, it is given in italics, and that's why it has meaning. Uzina. Uzina is nasal discharge. Blowing bloody mucus from the nose frequently. Blood rushes to the tip of the nose whenever stooping. Whenever patient looks down, blood rushes to the tip of the nose and it falls. Stopping of nose mostly at night, given in bold and has meaning. There are many children are brought to us with this problem, adenoids problem, and this is one remedy other than calcarea and tuberculinum in adenoids. Must breathe through the nose, a keynote even in diphtheria, long-lasting coryza, snuffles of infants. I have told you the sambucus, very important remedy. I used to use first as a sambucus. Then I think of other remedies, the hepar, nux, sambucus, ticta, which are mentioned over there. But in infants, specifically up to 1 day infant, sambucus works beautifully. Pit sore throat, tendency to gangrenous ulceration of tonsils, glands are engorged. So scrofulous diathesis is very, very marked in this remedy. In diphtheria or scarlatina, when the nose is stopped up, child cannot sleep because he cannot get its breath. And this is very typical, and that's why they want the smelling bottle or inhalers. Cholera-like symptoms at the commencement of menstruation, bovista and veratrum, and very important feature. Bold, given in bold, and all three remedies, ammonium carb, bovista, and veratrum, keep it in your mind. Diarrhea and vomiting at the commencement of menses. Don't forget these three remedies. According to the situation, use. Menses too early, profuse preceded by gripping colic. Acrid makes the thighs sore. Copious at night when sitting, like zinkum. Menses with toothache, colic, sadness. Sadness is characteristic of this remedy. Mental state is not mentioned over there in Allen by Allen, but the great sadness, the gloominess, the sulkiness, the carbon element, slowness, all are characteristic which used to happen in such types of person. The toothache, the colic, sadness, fatigue, especially of the thighs, menses associated with yawning and chilliness. These are two important features which comes as a concomitant to it. Leukorrhea. Leukorrhea is watery. Burning from the uterus. There is severe burning from the uterus. Acrid profuse from the vagina. All discharges in ammonium carb, they are acrid. Excoriation of vulva. Excoriation of vulva because of leukorrhea. Excoriation of thighs because of menses. Acrid leukorrhea. Dyspnea with palpitation, worse by exertion or ascending even few steps. See the modality, see the sentence. The diagnosis is always think that it is weak heart. It is a congestive cardiac failure. It is a congestion which produces dyspnea. It is a cardiac asthma, like loroshiraceus. This is a remedy for the cardiac asthma. Digitalis. This is another remedy for the weak heart. Worse in warm room. One of the best remedies in emphysema. Yes, air entry. Whenever the recent there are many peoples, they are suffering from the um, interstitial lung disease, lung fibrosis, and they have to keep these patients on the oxygenation or that machine. This is a wonderful remedy to be think of in such types of cases. Cough dry from tickling in throat, as from dust every morning from 3 to 4 a.m. Kali Carb, very close modality to the Kali Carb and very close symptoms to the Kali Carb. Panaritium. Panaritium is nothing but the inflammation and infection at the part of around the nail. In Marathi, we call nakurda. That is very typical. LMC also have the panaritium. Panaritium deep-seated periosteal pain like diascoria, the cilicia, the LMC. Body red as if scarlatina, compare Elianthus. So scarlatina, malignant fever, scarlet fever, this is one remedy. If it is malignant scarlatina for longer duration, think about this. Malignant scarlatina with deep sleep, stertorous breathing. Breathing is stertorous. That's why it looks like antimptard. The sleepiness is there in this remedy also, in antimptard also. Both are drowsy. Both are having stertorous breathing. Both are having rattling over there. And that's why we generally go for the antimptard instead of ammonium carb. But this is a wonderful remedy. One should not forget. This dizziness always remains during day. Miliary rash or faintly developed eruptions from defective vitality, threatened paralysis of brain. The forgetfulness, confusion of mind, is a very important indication, specifically in old people or those people whose heart is weak, who gets breathless on few footsteps. This remedy is a wonderful remedy. Tuberculinum and ginkgum are mentioned for the threatened paralysis of brain. Few symptoms you must add over there is uremia. Another feature, because of congestive cardiac failure, the kidney gets compressed, uremia develops. Scrofulous diathesis you can add. Heartbeat, congestive cardiac failure with difficult breathing, that is another feature. And sleepiness during the daytime, that is another feature one must add. Relationship, it is antidotes the poisoning with rust and stings of insects, very important remedy. Affect the right side most, right-sided remedy. And inimical to the lachesis. So you cannot use ammonium carb and immediately followed by lachesis or lachesis followed by ammonium carb. Aggravation, the cold wet weather, wet potisis. Potisis means cold wet applications. From washing, aggravation during menses. Amelioration by lying on abdomen, like acetic acid. That's why we miss the remedy many times. Lying on painful side, like pulsatilla, amelioration. Lying amelioration in dry weather. And this remedy is having an in-depth action. This remedy is having 40 days of action. So see, this remedy we generally miss with antimptard. It is very close to antimptard. Because of weak heart, we feel that it might be antimptard. The rattling over there, the stertorous breathing, the palpitation, the drowsiness, the dullness. We miss this remedy in comparison with this. So one should not miss that. Second remedy which is close to it. These people also feel better by air, and that craves the air like carbovage. So carbovage is another remedy. We used to think in such types of stertorous breathing, craving for air, and associated with eructations, associated with the dizziness. We might confuse it with the carbovage. But see, in both remedies, the carbon is common element. Ammonium carb is carbon and carbovage is again a carbon. Carbon elements common produces very similar symptomatology between each other. And because of which we generally miss and never looks towards the ammonium carb. My suggestion is that read this remedy from the Borix Materia Medica, and as far as possible, read it from Kent's Materia Medica. You will get the depth of it. Then you will never forget. Then you will catch the remedy very easily. It is a wonderful remedy in practice. Always useful for many complaints, respiratory complaints, GI complaints, even in heart complaints, and most commonly, that is the female complaints, the remedy is very, very important. So that's all regarding the ammonium carb. We have learned. We'll meet on Monday with another remedy, both the sessions. Whatever queries are there, you should ask the queries so that we'll have a chat, or I will try to answer your queries. So that makes it more two-way communication. So any queries are there, we'll have a chat, otherwise we'll conclude.
Sir,
Yes?
suppose if a person is indicated with we are giving one constitutional remedy, for example, phosphorus.
Uh,
So, suppose we have given phosphorus 200.
hmm.
So next month, shall we go with phosphorus 1 m? That next month phosphorus 10 m, and like that we should go and continue,
If,
or
if, if patient is improving 200, wait for it. And when patient starts again falling down, think about the susceptibility. If susceptibility is good enough, then you go for high. If susceptibility is not good enough, then don't go for high potency. Susceptibility should be high. Then you can go with high, and still the patient should show the same phosphorus. If it is a constitutional phosphorus, then it is your, my suggestion is always go for the high. 1 m, 10 m, even sometimes 50 m you can go, but at a very big intervals. And for that purpose, the patient should continue this with you. Patient
sir,
should
in
come to you.
between,
Hmm?
oh,
In
okay, while giving phosphorus, in the meanwhile, I have read your one of your notes. Shall we give can we give tuberculum in the middle, sir? If he is catching cold regularly,
in
now it is the
summer,
month of February.
yeah,
February and March is coming. Can we go with tuberculum
yeah,
one dose
yeah,
in the mean of?
definitely. Tuberculinum 1 m, 10 m, 50 cm. Generally, I used to give during summer weather to all those who used to catch the cold. This has been mentioned somewhere by Kent, mainly in lesser writings, I think so. But it works beautifully. The tendency stops because of that.
Okay, we have to start with 1 m.
1 m, always better, 1 m. One dose, 1 m
Sir,
sufficient.
should it be given in monthly interval or
Yeah,
in long
monthly,
intervals?
monthly, monthly interval.
Okay, sir.
Sir,
Thanks.
sir, one query, sir.
Yes.
One query, sir.
Hmm.
One query.
Yes.
Can Calcarea floor 6x can be used frequently or repeated bio?
When you are giving in 6x, that is biochemic doses, you can repeat, safely repeat. In case of
Safely repeat.
biochemic, you can safely repeat. In homeopathic, that is, if you are giving in centesimal, don't repeat.
Okay, Calcarea floor we can 6x bio we can repeat for 15 days.
Yeah, yeah, you can repeat for months.
Two dose a day.
Yeah, 4 tablets twice a day.
Okay, sir. Okay, sir.
Poonam, she has asked cholera-like symptoms, Bovista, ammonium carb, veratrum album. It is given in books. Cholera-like symptoms at the commencement of menses. And in bracket, he has written Bovista and veratrum album. Veratrum is another remedy. So that's all for today. Thank you being there, and
Thank you,
ask
sir.
your friends to join so that we can have a good communication. Okay?
Okay, thank you, sir.
Thank you. Good night.
Good night, sir.